My name is Andrea Korenjak. I'm an Austrian musicologist, psychologist and flautist, and I'm currently conducting the project Music, Medicine and Psychiatry in Vienna in the first half of the 19th century. So I'm a musician, I love music, and I studied both psychology and musicology, and I wanted for me to bring both fields together, so I considered music therapy as a research field. In this project, I investigate the very beginnings of the use of music in Vienna in psychiatric institutions. The time around 1800 is really fascinating. At that time, new buildings and institutions exclusively for the mentally ill were established. Furthermore, mental illness was recognized as treatable, and psychiatry evolved into a distinct medical discipline. All these developments ignited a new interest in music as a remedy. Some of my research questions are: how was music concretely used and applied in psychiatry in Vienna at that time? How was the effect of music on the human body and soul explained and described by proponents of music psychiatry and also music aesthetics? And what knowledge did physicians generate from clinical practice? One of the most important advocates for the use of music in Viennese psychiatry was Bruno Görgen. He was the one who also founded a private mental home, the first one in Gumpendorf and the second one in Oberdöbling. In these mental homes, he employed music for the treatment of the mentally ill. And the building in Döbling still exists. It's currently used as the Döbling district courthouse. So in the 19th century, patients were encouraged to practice music actively. So we can see kind of a paradigm shift from passive listening to music towards active music therapy. Patients were, for instance, encouraged to give asylum concerts where guests were invited. One of my personal highlights was an invitation I got from Thomas Dixon from the Center of the History of the Emotions in London, and I was invited not only to co-organize a conference on music, medicine and the emotions, but also to visit this institution for a longer period of time. And the Austrian Science Fund sponsored this research stay. So the question if music can really heal patients is really fascinating, and I try to contribute the historical perspective to this theme.